In this video, we will explore the complexities of pulmonary arterial hypertension, PAH, including its genetic basis, risk factors, classification, and association with other conditions. We will also discuss biomarkers, pulmonary vascular remodeling, treatment options, and considerations for pregnant and pediatric patients. In the video on pulmonary arterial hypertension, PAH, genetics, we explore the genetic basis of the disease. Mutations in genes such as BMPR2, ALK1, and ENG are strongly associated with PAH, causing smooth muscle cell proliferation, endothelial dysfunction, and dysregulated signaling pathways. However, not all PAH cases are linked to genetic mutations, with various environmental and epigenetic factors also contributing. Understanding these factors is crucial for targeted therapies. In pulmonary hypertension, endothelial dysfunction is a key factor. Nitric oxide, prostacyclin, and endothelin-1 play important roles in regulating pulmonary vascular tone and remodeling. Impairments in these pathways lead to increased vascular resistance and progression of the disease. Accurate hemodynamic assessment is crucial for classifying and managing pulmonary hypertension. The World Health Organization has a comprehensive classification system based on hemodynamic parameters obtained through right heart catheterization. This system divides pulmonary hypertension into 5 groups, with Group 1 being PAH. Hemodynamic measurements like mean pulmonary artery pressure, pulmonary capillary wedge pressure, and pulmonary vascular resistance provide valuable information on disease severity and response to treatment. These measurements help guide therapy decisions, including choosing targeted therapies and considering invasive procedures like pulmonary artery denervation. A good understanding of the hemodynamic classification system is essential for personalized treatment strategies and improved patient outcomes. Pulmonary embolism, PE, can lead to pulmonary hypertension. Diagnosis involves assessing clinical presentation, risk factors, and imaging studies like CT angiography. Anticoagulation therapy is important for acute PE. Chronic thromboembolic pulmonary hypertension, TEPH, requires more aggressive interventions like pulmonary endarterectomy and targeted medical therapies. Understanding the mechanisms, diagnosis, and treatment is essential. Chronic thromboembolic pulmonary hypertension, TEPH, is a rare but potentially curable form of pulmonary hypertension. It is caused by residual blood clots in the lungs after a pulmonary embolism. The pathophysiology involves impaired clot breakdown, changes in blood vessels, and ongoing clot formation. Pulmonary endarterectomy, PEA, is the preferred surgical treatment for eligible patients with TEPH. However, not all patients can undergo this surgery, so alternative medical therapies like Riosequat and balloon pulmonary angioplasty can be used to improve symptoms and exercise capacity. It is important to understand the causes, mechanisms, and treatment options for TEPH to identify suitable patients and provide appropriate care. Pulmonary hypertension is commonly seen in patients with congenital heart disease, particularly those with left-to-right shunts, valve issues, or complex cyanotic defects. It requires a multidisciplinary approach for management, including medical and surgical interventions tailored to each patient's specific condition. Pulmonary hypertension is a common complication in autoimmune diseases like systemic sclerosis and lupus, leading to poor prognosis. Inflammation, immune responses, and vascular changes contribute to its development. Early recognition and aggressive treatment are crucial, using immunosuppressants, vasodilators, and endothelin receptor antagonists. Biomarkers in pulmonary hypertension offer valuable diagnostic, prognostic, and therapeutic monitoring tools. Key biomarkers include NT-proBNP, troponins, von Willebrand factor, and specific microRNAs. By incorporating these biomarkers into clinical practice, risk stratification, therapy selection, and disease understanding can be improved. In the section on pulmonary vascular remodeling, we explore the cellular and molecular processes that drive structural changes in pulmonary hypertension. Topics include smooth muscle cell hyperplasia, fibroblast activation, and dysregulation of extracellular matrix homeostasis. Key targets for therapy are growth factors like TGF-beta and pathways like ROA/Rho kinase and BMP signaling. A comprehensive understanding of these processes is essential for devising effective treatments. Over the past few decades, significant advancements have been made in the pharmacological management of PAH. Traditional therapies such as endothelin receptor antagonists, phosphodiesterase 5 inhibitors, and prostacyclin analogs have shown efficacy in improving symptoms, exercise capacity, and hemodynamics. However, the advent of novel agents has expanded the therapeutic landscape for PAH. These include soluble guanylate cyclase stimulators like Riosequat, selective prostacyclin receptor agonists, and medications targeting BMP signaling. In addition to reviewing the mechanisms of action and evidence supporting the use of these agents, this topic will explore combination therapy strategies and the potential for disease-modifying effects. Understanding the latest pharmacological interventions and their mechanisms of action is crucial for optimizing treatment outcomes in patients with PA. Pulmonary hypertension is a significant risk during pregnancy, affecting both mother and baby. Various medical specialists must work together to manage the condition, selecting medications carefully and providing regular monitoring to optimize outcomes. This video will explore the impact, management, and counseling considerations for high-risk patients. Pulmonary hypertension can occur in children and has different causes than in adults. Diagnosis requires various tests, and treatment focuses on improving oxygenation and reducing pulmonary vascular resistance. Clinicians must consider the unique challenges in managing pulmonary hypertension in children. In conclusion, pulmonary arterial hypertension is a complex disease with various factors influencing its development and progression. It requires a comprehensive understanding of its pathogenesis, diagnosis, and management. Continued research and collaboration are essential to improve patient outcomes and develop innovative treatment approaches.